start off with a prayer of Psalms 139:14. I will praise thee, for I am fearfully and wonderfully made. Marvelous are thy works, and that my soul knoweth right well. I think that's a really good place to start because God built us by his design, and there's purpose to how he made us, and it's a beautiful journey on his design. So we are doing this session a little bit differently so that we can have it a little bit more interactive, a little bit of a Q&A. So I appreciate Sister Shay collecting the questions so that we could have some start to where we're going. First, though, I'll kind of give an overview to women's physiology and hormones and how we navigate through our life from puberty through menopause. So when we start with puberty, that is basically, and I'm going to give a general overview. So from puberty all the way to menopause, puberty is when all of our hormones come online and we start ovulating, basically. So what is ovulation? When we have our first period, all of the hormones have already come online. That means that our hormones that trigger an egg to be released from the ovary has already happened 2 weeks prior. When we have our period, we call that day 1. And typically that means the first day of bleeding. So sometimes we can have some spotting, and then we have a full flow. The full flow is the first day of our cycle. So that's day 1. And then on a perfect textbook type of menstrual cycle, we would go through the cycle and end at day 28. After that day, we start the next month and we get our first day of full flow and we get our period. Periods on average last to about day 7, or, well, day 7 would be the longest amount of time for us to consider a normal length of a period to be. It can be shorter, of course, so up to day 7. Then when we get to day 14, I'm just going to talk about some landmarks. Day 14 is the textbook day of when an ovary would release an egg. That happens on day 14. And then another 14 days, we're at the end of that menstrual cycle, and we start all over again to day 1. So textbook cycle is 28 days. 14 days at the midway part, that is when the egg is released. And this phase here, from day 14 to day 28, that phase does not change at all. So from the time that a woman releases an egg and actually has her next period, that time frame does not change. So if a woman has an irregular period, it means that something's happening over here that's making it very short or very long. But this phase doesn't change. So that's why you may hear when a woman has a pregnancy, with pregnancy, we date the gestational age, we call it, by the last menstrual period. And whenever the last menstrual period happened, we know that that pregnancy came about because an egg got released on day 14. So this part doesn't change. So let's go back to puberty. So puberty happens on average in the US about 12, 13 years of age. It can happen as late as 16 or 17 years of age, or as early as 8 to 9. And I'm sure you hear about how these ages are getting younger and younger for women to start going through puberty. It can happen as there is a little bit of a racial difference. More Caucasian girls at 9 years of age, African American girls down to 8 years of age. And it's it keeps getting lower and lower for reasons that we'll discuss in a little while. How to tell that puberty is too early, if it's younger than this age, and if it's too late, if it is several years after the first signs of the hormonal changes of the body happening. And if anybody has any questions about that, we can discuss that, on an individual basis later. So puberty begins with the onset of that first cycle. And then we're going to skip over this for a second and get to menopause. Average age of menopause is 51 years of age in the US. If it happens a little bit sooner or a little bit later, that's okay. Not normal would be under 40 years of age. That would be considered what we call too early of menopause. We would call it premature ovarian insufficiency. In the past, we used to call it premature ovarian failure. So another way to go through menopause would be through surgical menopause. If somebody has a full hysterectomy, you may hear about that, having a partial hysterectomy or full hysterectomy. That just basically means a partial hysterectomy is removing just the uterus and the cervix, maybe the tubes. A full hysterectomy is also removing the ovaries. Okay, so if the ovaries are removed, then that will make a woman go through menopause. If only one ovary is removed, it won't, because the way God designed us is that other ovary will take over all of the function. So they make for a good buddy system. So what happens in between these years is every month we should be having a cycle. And that means every month we should be releasing one egg roughly on day 14. One ovary takes a turn 1 month. The following month, the other ovary takes a turn. How many of y'all have heard that we will release all of the eggs, or we are born with all of the eggs that we will ever release? And that is true. So when we are born, so that means back in the womb, in mom's womb, when we are developing, our ovaries in our mom's womb are already developing, and all the ovaries that will, or all the eggs in the ovaries that will ever have to release to have a period will already be formed when we're born. Very different for a man. Oh, and let me back up. So for a woman, that means that she will release over the course of her life about 400 eggs. Only 400. One once a month during this time frame. For men, totally different. They're very wasteful. Every ejaculation, there are between 20 to 200 million sperm. I shouldn't say wasteful, because God has a plan for all of us. Just a little, wasteful. And those sperm are made kind of on the fly, so to speak. It's every 90 days, a new batch of sperm is made. So there is a difference as to what is environmentally sensitive for us. When do our eggs get made versus when does sperm get made? So there's a little difference there, which we can address later. So when we are going through our menstrual cycle, I'll go over this first so that we can go over a couple of the questions some of y'all had with periods. We're going to go over the hormonal cycle. So when we have our period, I'm going to go over a little graph of our hormones. So our hormones are all made from cholesterol. And skipping a whole bunch of biochemistry, we're going to go down to, we make from cholesterol progesterone, estrogen, and testosterone. And so for women, women and men both alike have these hormones. Our smallest proportion of this hormone is testosterone. For for men, that's their largest proportion. But we all have estrogen, progesterone, and testosterone. So for us, as we're going from day one, we start over here. This would be day one. It's 14. Here's 28. We're going to go over how our hormones change during this time. So when we are, I'll show you the example of, this is not a great artist, but this is the uterus and tubes that come off of it off the side, and then the ovary. This is the uterus, the womb, that's where the baby would develop, cervix, and then vagina. So this is where the miracle of life happens. When talking about a period, the ovaries basically are, all of the pelvic organs are stimulated by hormones in the brain that tell the ovaries what to do. They start producing, at the beginning of this month, they start producing estrogen. And that estrogen goes up throughout the first half of our cycle, and it causes this lining to thicken as it's preparing for pregnancy. So this estrogen goes up, and it kind of gets to about a peak around day 14, because by design, by God's design, we know that we want maximal preparation for when that egg is about to release. And this lining is getting thickened, getting prepared for that egg and sperm to come. At the same time, we have progesterone. Red. Sorry, not enough color difference here, but progesterone, in the meantime, is a little bit lower. When the egg gets released from the ovary, at that point in time, it's signaling, saying, okay, we're ready for pregnancy. If pregnancy does not happen, or I'm sorry, the rest of this cycle, we're still preparing for pregnancy, but the estrogen at this point is signaled to start decreasing. And progesterone increases, and they alternate in the second half of the cycle. So the progesterone's role is to maintain this uterine lining. When on day 28, the body recognizes that there was no fertilization, no pregnancy, then that lining gets told, okay, it's time to slough, kind of cleaning house, so to speak. So then, when it sloughs, you have a sudden decrease in progesterone. That's when you have a menstrual cycle. The ovaries, how this process happens is the ovaries are triggered by brain hormones to first produce estrogen and then later to produce progesterone. So it's kind of a good, dance between the two hormones that triggers this process. So if you can imagine, a lot has to go right. The more I live in medicine and care for patients, the more I'm amazed at the miracle of what God has designed. We think we know a lot about it, but there's so much that plays into it that really is a miracle, and it's all by God's design. It really amazes me. But there's a lot of environmental onslaughts too that can trip things up along the way. So we'll talk about that as to how do periods become irregular. So, any questions so far just about this part, about how our hormones are produced and switch out during the month? Just to recap, the first hormone is estrogen, and that's the proliferative one. Proliferative means that's what creates the uterine lining. And then the next one is progesterone, and that's the one that is more maintaining. So it's the one that will cause us to have maintain our uterine lining, create a need for us to retain more water, will kind of control our mood, that kind of thing during this second half of the cycle. Okay, so what things then can cause the period to be irregular? I hate to say almost everything or anything, but it's true. And another way of phrasing that question is, what can we do to ensure that we have in our childbearing years? So we consider childbearing years those years between puberty and menopause. And menopause, I should add, is the time frame when we stop having periods. So that means that we stop releasing eggs and we are no longer fertile. Menopause, by definition, is the time around menopause is perimenopause, so around menopause. Postmenopausal is after 1 year of no periods. And so we only really clinically have a diagnosis, and that, another way of saying that is we only know by talking with you if you've gone through menopause by looking back and saying you've had 12 months of no period. Around the age of 50, then we know that, okay, you've gone through menopause and you are now officially postmenopausal. When are periods irregular? Every once in a while, the delicate balance of what I just described kind of has to be a little bit perfect for us to have a 28-day cycle. A lot of things can disrupt a 28-day cycle. It can be stress, it can be lack of sleep, it can be many different things. We'll talk about that a little bit more. But if we continue to have regular periods, by 51 on average, we'll stop releasing the egg, we'll go through menopause and not have any more periods. What would we consider to be abnormal bleeding at that point? Any bleeding whatsoever. So if a woman around the age of 50 has gone through menopause, 12 months of no periods, any amount of bleeding after that is abnormal. It can be, the obvious one of, heavy bleeding all of a sudden. Obviously, that's abnormal. But sometimes patients will come in and say, well, I just had a little bit of spotting one time. You still want to check it out because we shouldn't have any bleeding from the genital area. And it can be really as simple as, oh, it may be from something completely different. It may be hemorrhoid, for example. But we still want to investigate because if there is actual bleeding from the uterus, the uterine lining, then that could be abnormal. It doesn't necessarily mean cancer. It could be many other things. Honestly, most often, it can be from dryness, which we call atrophy. And atrophy is just like when we get older, how many people get dry skin over time? That's atrophy of the uterine lining, and it can crack a little bit and give a little bit of spotting. So, but we still want to check it out and investigate that to see if that's what's going on. Okay, so that's after menopause. And they can be other causes, obviously, but that's the best take-home message. Any bleeding, any amount of bleeding after menopause, we want to investigate. Other than that, if there is some duration of period during childbearing years, so childbearing years is the time frame between puberty and menopause. And during this time, if we have more than 6 months of some kind of irregular bleeding, that can mean no bleeding whatsoever, no periods whatsoever for 6 months, or very irregular periods during that 6-month period of time. If we have 1 or 2 periods off here and there, it's okay. I reassure my patients at that point because our everyday is not the exact same. we sleep a little differently, eat a little differently, have different stress levels from day to day. So that can throw off our period a little bit here and there. That's okay. But if we have a pattern of over 6 months of irregularity, that's enough to capture our attention and say, okay, let's dig a little deeper and see what's going on. A normal period, I mentioned 28 days. There is a range. It can be between 21 to 35 days. So that means anywhere between 3 to 5 weeks. So it doesn't have to be every single 28 days or 4 weeks. It can be somewhere between 3 to 5 weeks. So I was, for example, every 3 weeks, which is not fun because you're using up your eggs a little faster. But if women go up to 5 weeks, that's fine too. Shorter than that is too often. More than that is too far apart. The reason being is if it's too close together, there's a chance that there may be too much bleeding. You could get anemic. If you go too long or no periods whatsoever, then what may be happening is if at the end of 28 days or at the end of that menstrual cycle we don't have any sloughing of the uterine lining, what do you all think can happen? It would just keep thickening. It would keep thickening and thickening. So, if there's no bleeding whatsoever, if there's a potential that it could keep growing and keep thickening and keep thickening, and that's not good. So, again, we want to investigate what is the cause for this pattern if sudden irregularity. Okay. All right. The other question that I have for patients when they come in is how long is the period? So earlier I mentioned up to 7 days. So it can be anywhere between just one day of bleeding, sometimes even spotting, depending on the situation, up to 7 days. If the period is longer than a week, that is too long. Then we start, again, starting to look into what kind of problems are happening. All right. See what question we had at this point. Okay, how much bleeding is too much bleeding on any given period? If a woman is wearing, and we kind of try to estimate it because no one's sitting there with a metric cup, and trying to figure out exactly how many milliliters is too much. In textbooks it'll say 80 milliliters. We don't have anybody who is measuring out their amount of bleeding. But as a general rule, we say, okay, if you were to take a medium-sized pad, if you are soaking it within half an hour and you're doing that for 4 pads within 2 hours, that's way too much. Okay, so if it is being soaked that quickly, then we need to find out what could be triggering that heavier bleeding, of course, because ultimately there could be a risk of anemia that could develop. So too long, more than a week of having periods, or too much volume, both of those can lead to too heavy periods. Another problem, very common problem that will happen with periods is painful periods. And many reasons for that, but one of the first things that causes normal period, this menstrual cycle, this menstrual lining, it had thickened and it needs to slough off somehow. So it's kind of like a scab coming off on your arm. If you have a little scab, there's some pain associated with that. There's something that triggers that scab to fall off. It's the same thing on the inside of the uterus. That almost scab-like tissue needs to come off. So the uterus, by design, has a prostaglandin hormone that triggers this area to kind of swell, the uterus to contract a little bit, and that's what we call menstrual cramps. Those same contractions when a woman is having a baby, similar idea here. The uterus literally has to push this stuff out, the menstrual slough out, so we get menstrual cramps. So if we have too much prostaglandin, sometimes those cramps can be severe and very painful. So, so keep that in mind. Other reasons for having painful periods, there can be, I guess I can dovetail to what problems we can have in the uterus can cause both pain and bleeding problems. So many things, few of the common things I should say, that can happen is, has anybody heard of fibroids? Okay, so fibroids are in the muscle layer of the uterus. So the uterus is made up of smooth muscle. It's a special type of muscle that's very different from the skeletal muscle that we have in the rest of our skeleton. Smooth muscle has kind of this predisposition that it can start to form some tumors that are not cancerous, that kind of ball up like a marble and can grow bigger and bigger. And if they get into the lining of the uterus, that can break the uniformity of the lining of the uterus and cause spotting or heavy bleeding. They can also kind of affect how the uterus cramps to get that uterine lining out, and it can cause pain. So that's fibroids. Another problem can be endometriosis. Has anybody heard of endometriosis? So there's a few different theories, biological propositions as to what causes endometriosis or how endometriosis develops. But the most common one, most common, simple, easy to understand explanation is that this lining on the inside of the uterus starts to work its way into where it's not supposed to be, into the muscle of the uterus. So when the uterus gets triggered to have a period and it's cramping, it keeps cramping more and more and more, trying to get this lining out. And you have inflammation that's just stuck in the muscle, and it just kind of fuses with more pain. So that can then lead to something else, or be a separate issue, adenomyosis, where you can have more of this type of tissue inside of the muscle of the uterus. This endometriosis, the basically glandular tissue, the lining of the uterus, can also come out through the tubes and get stuck on the outside of the uterus and then have nowhere else to go and throb, and that inflammation can get stuck on the outside, and that can cause more pain. It can also cause scar tissue. It can cause infertility as a result as well. Other issues that can cause problems in the uterus are polyps. So polyps, like little skin tags, that can also cause bleeding. Often they don't cause pain unless they get very large. And there are other problems, of course. There can be the ultimate, concern that we all have is endometrial cancer. Endometrial cancer early on rarely causes pain. It can more often cause irregular bleeding, and that's why we like to look into evaluating if a woman has irregular periods, why that is. So an evaluation, for example, would be taking a detailed history, talking to a physician about how, what is the pattern of the irregular bleeding? Does it correlate with any activities she may be doing, that type of thing? Then doing an examination, and then an ultrasound. An ultrasound would help us see the uterus and see if there is anything that may give us an idea of what is causing the problem. Then then other tests, depending on the situation. There may be a need to actually do a biopsy, a little sampling of the inner lining of the uterus. And that's called an EMB, which is endometrial biopsy. This is not done often, I don't want to scare you all, but it would be needed to be done if more information is needed about irregular bleeding, is usually the scenario. And this is an endometrial biopsy where a very, very narrow tube with a little, almost like a spoon at the end of it, helps gather some tissue so that we can take a look and see if there's any abnormalities there. Okay. So now let's talk about, had a question about periods and what can we do for painful periods. And I would also like to say, for general female health, what can we do? And my overwhelming conviction is that we really need to do all the things. Have you ever heard, everything affects everything? And it's so true. Everything is so interconnected in life. There is really no quick answer. We are noticing as doctors, gynecologists, healthcare providers, and I'm sure you all are noticing too, that it seems like there's more problems kind of going on in health in general, and specific to this topic. Girls may be going through puberty younger. More people are having hysterectomies. There's more endometriosis, more fibroids, that kind of thing. And it's because truly everything is connected to everything. So, and the way I like to describe it is because we are kind of in a environmental toxic soup, is what I call it. It's so many things that are affecting our impact. Most of the time, we'll think about, okay, our diet, how much of our diet impacts us, all of our health. That is one big thing. You can also eat all the right foods nowadays, but the food is made so differently than it used to be that it can be hard still to be eating all the right stuff. So for example, vegetables now are different than vegetables once upon a time, because once upon a time there was no glyphosate or Roundup, and Roundup is getting into our nutritious food. But the best guide as far as that is concerned, we'll talk about it in a little bit. Dangle that little carrot. The other parts of environmental soup are, what about our activity level? Are we going outside and getting fresh air? Are we mobile? The new smoke, I don't know if you all have heard, the new smoking is inactivity. But most people realize that smoking is unhealthy. It can eventually lead to lung cancer. But the next biggest cause of people having problems in life and dying from those problems are all due to inactivity. And that's because we're more likely to be in jobs that have us sitting down in front of a computer. Then we want to take a break. Well, then we're in front of our phones or watching a show or something like that. There's so many different things nowadays that lead to inactivity. And so I'm going to put this as treatment number 1. There's many different treatments for painful periods, ultimately even irregular periods, but also towards healthy pregnancies. I'm going to throw that out there. Number 1, by far, treatment I cannot overemphasize is exercise. And why? Why is that such a big thing? And you always hear, okay, diet and exercise, that kind of thing, but why exercise? Whatever in our body is hurting or is sickly, let's say the uterus, for example, they need nutrients. So your organs will need nutrients. The main nutrients in life are oxygen, water, any kind of nutrient that will feed the organ, or even medications, whether it's an herbal remedy, pharmaceutical remedy, doesn't matter. We basically need this, right? trying to put fuel. So fuel to fuel our cells. So we need oxygen, water, nutrients, fuel, and any kind of medical treatments. How do we get these elements to our ovaries or to our uterus? It's through our circulation. Well, how does the circulation work? It works better always when we have exercise, when we're moving around. Otherwise, everything truly does get sluggish, and we don't open up the flow in our all the way down to the capillaries. So why this is so important is because Sister Shay and I were just talking about this. We, in typical traditional medicine, allopathic medicine nowadays, everything is very siloed. There are special names to get given to certain, medical problems, and they're treated as completely separate from any other medical problem, and given a specific medication for that certain medical problem. What is really not appreciated is that a lot of the chronic medical problems are all due to inflammation. And that inflammation has to go through our circulation and go through our entire body. So if I'm having problems with one joint, that same inflammation from that one joint is going to course through my blood and hit all of the other organs and then circle on back to that joint. So this is why exercise is so important. If we are able to exercise in any capacity, we are going to move oxygen, water, nutrients, whatever aids we have in our circulation to that tissue. So that is why, for example, after surgery, I tell patients, you have to walk. If they have a hysterectomy, a bigger surgery, we say, okay, that day you can sleep it off, but the next day you wake up, you got to at least walk, because that circulation will bring all these good things to the surgery site and help it heal faster. So it's the exact same principle for the uterus that may be having problems from even endometriosis, big fibroids, anything. You're going to have ultimate benefit from exercise. It's just going to be the long game. We just got to play the long game. So I know Pastor Spell had a sermon, I'm not exactly sure on the day, but it was about convenience, and how we are basically dying for our conveniences. And that's the life that we, are born into, and we really have to remember that when we are getting something a little bit quick and easy, and we may get benefit from immediately, that nothing in life is free. Downstream, we're gonna have to pay for it. And so I have to remind myself of that every time I use Amazon. Because I'm like, I have to get myself off of this habit. But when, unfortunately, modern life and modern medicine reinforces this bad habit because, we just take this medication and we feel better tomorrow. Well, obviously that worked and it's the best thing for me, not realizing that 3 months from now we may feel worse, and completely not connected to the fact that we're experiencing some side effect downstream. So the long game is, we're not going to feel better after exercising the next day. In fact, we're going to feel worse. If we don't exercise at all and then we exercise, we're going to feel sore, we're going to feel tired, and our brains are going to say, see, this is not the way to go. We just have to reinforce that the benefit is going to come later, but it's going to be lasting. And that's how it helps with women's health in general, our overall health. And that's the nice thing, is that on one side, when modern medicine silos everything off, the holistic approach is more all-encompassing, that by doing, and we're going to go over several other approaches, but when we do it from a more holistic manner, we're going to do it for fixing painful periods. But, by the way, you're also going to lower your heart attack risk and your dementia risk and your diabetes risk and all these other things. So the long game is so worth it. The overall approach that I tell patients, I think, is best summarized by Barbara O'Neill. she summarizes it as sustain me as an easy way to remember. The E is at the end, but I like to put it at the beginning of exercise. But going down through everything, we start with sunshine. So sunshine is very important. When we used to always be outside. We had to deal with the elements, and there's so much goodness from the sun. If somebody is fair-skinned, we could all benefit from early light. At the beginning and end of the day, when the sun is setting, we get those, we call it red frequency waves, where you're not going to have damage to your eyes. Obviously, never look directly into the sun, but when you're looking into the sky and getting that natural light, that gives us a lot of good information input into our eyes, to our brains. During the day, we do want to get some sun directly on our skin, and that's going to vary from person to person depending on if you've had any recent sun exposure. If you're very fair-skinned, if you're African American, you'll have to vary the length of time in the sun, but direct exposure will give you some vitamin D hormone that will be produced in the skin. And vitamin D, it has been shown, several studies have shown that vitamin D, along with omega-3s, other supplements, can help with, for example, cramping, period cramping. So sunshine is very important. When you're getting your sunshine, you're already out in fresh air. So you're outside. So it's good to get that fresh air. U stands for use of water. So you want to stay well hydrated. If we are dehydrated, when I was describing that cramping reaction, when the uterus is trying to push out that period slough, it's going to have to work a lot harder on a dry, more dense menstrual slough than if you are well hydrated. It's light and fluffy, and it's going to come up more easily. So very important to be well hydrated. The other S is, oh goodness, sleep. Okay. Sleep is when we heal. That's when we just shut down and we let God's plan take over. And our bodies basically know what to do. We just gotta give our bodies a rest. Case in point, anytime anybody here starts feeling a little sick, a little cold, and just in the back of your brain, you have this thought that maybe I'm getting sick, listen to that voice, because you're probably getting sick. And that's the moment at which, if you stop everything, go to bed, give your body rest, your immune system will have a better chance at kicking in and warding off you getting into a full-blown cold or what have you. So sleep is when we heal. So if we're able to heal and have all the other good stuff, exercise, nutrition, etc., online, when we're sleeping, that's when we heal. The best way to sleep is have regular sleep, not just 8 hours, but different parts of the day. It's like do from 9 at night to 5 a.m., somewhere in there. 7 to 8 hours for women during childbearing years is a very good amount of time. If you do feel so tired that you want to take a nap, then try to take no more than 30, 45-minute nap. If you take a 1-2 hour nap, then it's going to really affect your circadian rhythm for that night. So it's good to go ahead and let yourself rest, but do it earlier in the day for 30, 45 minutes max, and keep it regular. When the evening comes, think of that signaling that your brain gets, the messaging that your brain gets on when it's time to sleep. So when it's time to sleep, turn the house lights down, make it darker. Don't look at screens, all the artificial blue light will keep our circadian rhythm off. So that's another thing to pay attention. Okay. Another thing. Next thing is, well, this one y'all do very well. Trust in God. Faith life is very important. And praying, having that time to listen to your to God speaking to you in your inner voice, that type of thing, that has tremendous healing power as well. A is for abstaining, so basically the obvious stuff, abstaining from drugs and alcohol. That is all harmful for all our tissues, and it does circulate through all of our tissues, so not good. I is for inhale, so fresh air. N is nutrition. I'll get back to that one. M is moderation. So moderation is really not overdoing any one thing, even exercise. So for example, not suddenly launching into the boot camps and stuff like that, and doing all crazy, twisting your joints and breaking yourself. Just moderation. All right, so nutrition. Good, healthy nutrition, and we can go deeper into this in another segment because there's so much to say there. But the most important thing, I would say, if we were to say what would be the top 3 things to do or not do, I would usually tell patients, you know what, don't change anything, don't eliminate anything out of your diet, but just add. And when you add something, do it first. So meaning when you get to a meal, do your healthy foods first and 2 glasses of water. And then if you want whatever fried food or things that are less healthy, you may very likely find that you're going to be able to eat less of it because your stomach is full of fiber and water already. So the top 5, I would say, most inflammatory foods. Top 1 is sugar. And sugar is fun, but it's very inflammatory, especially the way it's done now. One of the worst sugars is high fructose corn syrup. Is everybody familiar with that? We don't have to cover that too much. It not only makes things taste sweet, potentially addictive, but it also is very diabetogenic, we call it. It triggers, for the same amount of sugar compared to regular table sugar, it will trigger your body to be more likely to develop diabetes for the same amount of sugar. So I'm not a soda drinker, but I think almost all sodas have high fructose corn syrup. I could be totally wrong. I'm sure there's some healthy sodas out there, but I would be really looking at, if you really like the bubbles, do like sparkling mineral water or something like that. Everything else has chemicals and big sugar in it. But sugar, why I mention that first is because it is tricky, because it's not just the sweet foods that have sugar in it. Sugar, the sugar lobby has lobbied the government to try to cram pack their product and offload it into other products, and then get subsidized reimbursements for that. So you find sugar in places you didn't think you would, like bread that doesn't taste, or sausage. If you've noticed, a lot of things end up with more and more sugar in it. Even spices that used to be only savory and salty now have an addition of sugar. Medications have an overload of sugar. Even simple NyQuil has a ton of sugar in it. So it's in a lot of places, and sugar is not just, like I said, the sweet stuff. It's also the flours. So anything that is made from flour nowadays, unless you really comb through your ingredients very well, the flours that are used to make pastas, make breads, have been refined to the degree that they're very small particulate. They are already pre-broken down for us. Purpose of it is that it spoils less, so it has a longer shelf life. Anything that has a longer shelf life is killing us faster. Just a good way to remember that. But it also makes breads fluffier. So it's used very, very frequently. The problem with that is those very, very ultra processed flours go into our bloodstream just like sugar. They spike our sugar and our insulin just as quickly as if you were to eat table sugar, or maybe worse. So those are things to remember. So sugar And it is possible, believe it or not, to live without sugar. So, or sugary products. It is a process though. So it's something that you can slowly, take away. But because it's so inflammatory and it's in our bloodstream, so it's going to circulate through all our organs, including our uterus and our ovaries, it's going to have that bit of inflammation around the ovaries. So it's going to affect the production of hormones in our ovaries, and it's going to affect the uterus, and that sitting inflammation is gonna continue to brew and cause a problem. So that's one of the most inflammatory things today. Next, I would say fried foods. Um, why fried foods? For two reasons. One is that the oil that we have to use to fry foods in um, is usually a seed oil, and those the way that they are made and the oil is extracted from the seed, it's pretty harmful process and ends up with a inflammatory product. But then you heat it up, and it may go at any point in time between production and use. It can go rancid, which means just old, but you can't necessarily detect that. So that's another problem. And then with heating it, it further kind of denatures any of the benefits of the oil. So you can hear about, let's say, olive oil can be great, but we really shouldn't be cooking with olive oil, believe it or not, even though we have that expression. But it actually was meant in the Mediterranean diet to be drizzled over salads because that oil helps for us to absorb fat soluble vitamins. So that's how it works. Is after you finished your cooking, you drizzle a little bit of olive oil, fresh olive oil on it. And then I will throw this one in there as the top one is barbecue, especially if there is any burn on the food. That black char, that will really create a lot of inflammation. So I'll leave it at these top three, and we can discuss nutrition later. But those would be, I would say, my top three to be watchful for. Okay, so just see on that basis what things to look out for. Okay, so I had a question about um, what causes changes in cycle length. So all of these things, anything in our life that can trigger any kind of disruption in our life. One thing I think we don't have here is stress. Stress is very significant. That can definitely trigger a period to be irregular. I did want to mention that as we adopt all of these elements into our life, not only will our periods get lighter or less painful, less problematic, it will also eventually translate to a better transition into menopause. So menopause, we hear a lot about hot flashes, terrible symptoms. Um, the more healthy we are going into menopause, the lighter the symptoms are usually, is what all the studies are showing. In fact, there was a multi-country study to see how different women in different cultures deal with menopause, what medications they take, how do they go through it. And when they talked to Japanese women before our standard American lifestyle hit Japan and everybody got unhealthy, when they were asking, then the Japanese women just really didn't know what people were talking about when they were saying hot flashes. And they came to realize that there was no Japanese verbiage for hot flashes because they just didn't experience them. They just rode right into menopause and they said, well, I just stopped having my period. That's about it. And so they found that they were, in many different respects, quite healthy. So on average, that's been found that women who are a little bit more healthy going into menopause have better symptoms. Okay. Um, Okay, there was a question about recommendation for cramps. So bad menstrual cramps, painful menstrual cramps. One of the best treatments, believe it or not, is exercise again, for the reasons that we discussed. I would tell my patients there are many, if you want to know if there are herbs to help, there is a large, long list of different herbs that can help with painful periods, but it is very person specific, and it's kind of a trial and error of what would work for you, and we can talk about that separately one-on-one. But so I won't do a detailed review on that. There are herbal remedies there, but I would say in the meantime, you would always want to be adopting these different applications in your life. Immediate help would be cold packs or ice or heat packs on your lower back or in front of your belly to help with painful periods. That can help right at the moment. Typically, I would ask patients if how much is it affecting your life. So just like any condition, I would say, is the pain to the point where it is still tolerable, you're still able to go to school, or you're still able to go to work? If so, then you're still functional, and we can try these remedies, but it is a clinical problem if you're not able to. So for example, if the pain gets to the point where somebody is throwing up and not able to go to school, doubled over in pain and needing a narcotic to be able to get through the pain, that is abnormal. That is a level of pain that would require a workup. That's when we would say there's something a little bit more going on here. The intermediate, let's say pharmaceutical help, I really had never prescribed narcotics for painful periods. Again, that would require its own workup. I would say if it got to the point where we need some intermediate, a little bit more help before these remedies kick in or herbal remedies kick in, ibuprofen. I would say ibuprofen because ibuprofen, which is Motrin, Aleve, it's non-steroidal anti-inflammatory medication over the counter. Because this medication does stop the production of more prostaglandin. So if you remember how we talked about prostaglandins causing the uterus to cramp or that period lining to come out, NSAIDs, which is Motrin or ibuprofen, causes there to be less production of prostaglandin. So what a young woman would then do is start taking that a day or two before her period would begin to lower the amount of prostaglandin and have less pain. Similar. We would work in a similar way. Okay, yeah. And so, but in the meantime, I would say you definitely want to be working on all these things, and we would expect some improvement in, 2 to 3 months. But at least we would, I would say, take these NSAIDs in the meantime so we can get you to be functional, because we don't want to be missing school or work. That would not be a normal amount of pain. Okay. Okay. There was a question about this trend of very early puberty and what is causing this to happen. So I think I mentioned a environmental toxic soup. So we're in it, and when we develop as women, we really are formed already in the womb, in our mother's womb. So what happens to our mom and the environmental toxins that our moms are exposed to are passed down to us from the womb. So there's lots of environmental impacts, more and more, that are coming. Ones to watch out for are, I'm going to throw this one out there one more time, is everything that makes us more sedentary. So exercise. If you notice a trend, I keep going back to this, and exercise. So more and more our young women are more sedentary, more in front of a computer. So, I know it's hot in Louisiana, but I would still encourage our young girls, boys alike, go outside more. Be active. If it's too hot, we got to go to a swimming pool. We got to do something. We've got to be active. That's one thing. As they get older, even taking a study break if they're at school, etc. They always try to encourage some kind of motion and exercise throughout life. Another thing to watch out for, be mindful of, is with respect to food and how the hormones in food are affecting us. The meat and dairy. So dairy is a significant one. Some people can be very sensitive to allergens in milk. So that's one problem. Another is when you think about it, mama cow makes milk for a baby cow to grow really quickly into a several 100-pound cow within a year. That's a lot of growth hormone. So now we're drinking it. So we have to take that into consideration, that those hormones, natural hormones in the cow, are also we are drinking them. In addition to that, animals are also being given hormones to grow faster for food production. So that is also all getting downloaded into our ovaries, and so we're going to end up having earlier puberty as well. So meat, if at all possible, if you suspect that a young girl is starting to have changes towards early puberty, my recommendation would be to completely stop milk and dairy products, because that is concentrated hormones, and really watch the meat and try to get it to where it is organic, out in the open, what do you call it? Free grazing, free range meat, because that's the meat that is least likely to have an hormonal impact. And then estrogen disruptors. We could have a whole talk on estrogen disruptors, but they are everywhere. The plastics in plastic water bottles, in our food containers. Anything that is plastic, be mindful of and try to get away from plastics as much as possible. For example, water bottles, to try to get more towards stainless steel containers or glass. Your Tupperwares at home, try to get glass Tupperwares. Definitely don't microwave in plastic. If anything, better just to not use the microwave. I myself have to get away from the microwave too, because it does have a way of denaturing the quality of the food when it heats food, the microwave. But also, if your food is in plastic, it causes more of that plastic to leach out into the food, just like the water in a water bottle. Another endocrine disruptor, they are found in our clothing. So clothing that is more soft, less wrinkly. There's chemicals that are used to make our clothes more soft, less wrinkly, and they're basically a form of plastic. They're also endocrine disruptors. Now, this is a tough one because it's hard to find, good sources that are affordable, that have organic products, that don't have endocrine disruptors. But one example would be to try to steer clear or wear less of lycra type of materials for exercise, for example, because then we sweat in that, and that's more likely to leach into our body through our skin. Our skin is a large organ that will absorb anything that potentially that is put on it. So that brings me to cosmetics and creams. Also, to be very careful about the products that we have there, that we wash with or that we apply onto our skin, that also can have endocrine disruptors. And endocrine disruptors are basically something, a molecule that can act like an estrogen or disrupt the function of estrogen. So it can basically mess up our hormones. So something to look at. So especially for young girls, to be mindful of. Yes. Uh-huh. Oh, you're asking for a recommendation of what to wash? I use Dr. Bronner soap. Dr. Bronner, and I can show you a link for that. Is anybody familiar with that soap? It's like a Castile soap. And there's several out there that are pretty clean products that don't have a lot of extra ingredients in them. Another uh, addition that I have to the laundry in uh, instead of OxyClean to make clothes whiter or brighter, there's an eco product that's similar to it that's a little bit more clean. So short of completely washing with just water in your hands, there are other products that are cleaner, and you can start to go in that direction to get more and more clean. Another addition, for example, since it's so hot and humid in Louisiana and clothes are more likely to be sweaty or even musky, adding vinegar, just a cup of plain vinegar, and washing your clothes in hot water helps. Well, you can add your soaps, you can add the detergent, but then add a vinegar. Sometimes, if I have towels that may have sat around, every once in a while, I kind of think, when that would happen. But if, there's some towels that may smell a little musky or something like that, if that were to happen, I would wash it just with hot water and a cup of vinegar, and then wash it a second time with soap and everything else. Because the vinegar will kill the mold and spores. So obviously, bleach you would use with white products. You don't want them to stain anything. Bleach is good to kill mold, but it may not necessarily kill the spores. So you can do one or the other. No problem. Yes. So, and there's many products out there, so it's good to research and see what products are good out there. A great resource for that is EWG. I think it's ewg.org. It is a user guide that looks at home products and cosmetics. Yep, ewg.org. And when you go on there, it's a great resource that reviews products. And please, if y'all find a product that you like, let me know, because we're journeying together. So I'm definitely up for, and these products can sometimes change. Sometimes there can be additions or new information found out about one product that, oh, maybe it's not so good over time, and we switch to something else. So it's kind of a learning journey. Okay. Um, we have we had a couple of questions about fertility or infertility, and that would be probably its own talk completely. I don't take care of men, so I wouldn't be able to answer any questions towards men's situation, but can research it for a future talk. But there was a question about wives' tales about, in terms of trying to get pregnant, about having the feet up on the wall after to try to after sex to try to help with fertility. Is it a old wives' tale? Yes and no. That may sometimes be said to patients because, in order to help improve um, conception, you don't want somebody to run up and go to the bathroom and flush everything out. You kind of want to give it a little bit of time for nature to do its work and the sperm to find its place of where it needs to go. So from that perspective, if you're going to be sitting and resting in any position, you kind of want gravity to take its course. So do you have to have your feet up on the wall? Nope, not at all. It's just more laying still is the idea. Let me see. This is the next question. If you are past childbearing age and there is no real medical reason to have a hysterectomy, do you still recommend having one? No, not at all. I would not recommend any surgery that is not necessary. And patients have asked me this because they said, well, all of my friends are getting hysterectomies. It must be the thing I need to get done. No, just because you have gone through menopause and the uterus is no longer creating a period doesn't mean that everything is not working. For example, the ovaries still continue to produce some hormone, a little much less, but still produce, for example, some testosterone for years to come after menopause. So there's still something happening there. You also never really want surgery unnecessarily because all you're doing is, if you're not having any problems, then all you're doing is incurring potential risk. So you definitely don't want that. The follow-up question was, would you want to prevent future issues? You don't know if you're going to have future issues, so no. It's not a guarantee that everybody's going to have future issues, so definitely not. Another question in my clinic would be, well, what about ovarian cancer? And so I know the cancer statistics can sound very scary, but I would tell my patients that we know in order to prevent cancer, all of these things are helpful. And if you get cancer, you should be doing all this stuff anyways, so why not do it now? And if you flip the statistic on cancer, then the majority percentage means you're not going to get it. So, so that's one way of looking at it. An exception to that is certain genetic mutations that really increase the risk of cancer, like the BRCA genes in specific populations, like Ashkenazi Jews, for example. That's a little bit of a different conversation, but for the vast majority, it's a little bit more of a discussion on your personal family history, but for the most people will not get the said condition. So that can alleviate a little bit of anxiety. I didn't know what this meant. What is your opinion on cycle syncing? Syncing a cycle, was that anybody here? Okay. Okay. So I see. Okay. So just to repeat, the question is cycle syncing. So this is a new concept to me, but I get the concept that you would do at different parts of your cycle. You would do different things for your body, such as specific exercises or specific nutrition to help where you are landing in your hormone levels, for example, at that point. And that makes sense. Um, Considering all the counseling that I do for my patients on all this, I would probably lose most of my patients on the detail that you would have to go to for that. I like the concept, and I would see that it would be for very motivated patients, but I don't think it would be needed if you're doing all these things on an average day. I'm a big believer in the habits that are good for us that we form to try to do them on the daily. is what's going to get us to generalized good health, and then we won't need a lot of very specific things, because then we'll have more balance in our hormones when we get to that point, and it's not going to, for example, we won't feel as bloated when the progesterone is up as we would if we're going into that luteal phase, second phase of our cycle, if we're already going into it healthy overall, for example. That would be my view on it. I find I do like to simplify a lot of things that I do in life. I know this may be overwhelming or a lot, but I would encourage just to add a little bit every day. Ultimately, I view this as a simple way of living and try not to complicate it too much, because then I personally would feel frustrated, like, oh, I got this on the wrong day. Okay. Okay. Just a couple of quick things. Anemia, I didn't mention that. Iron bisglycinate. Anemia is a big thing, and we always hear that during our cycle we may want to take in, if we need to take in a little bit of iron, a specific compound, glycine, iron bisglycinate is what it's called. I'll write it down. Is a good supplement to take for anybody who may be anemic, because it has the lowest side effect profile and the highest absorption. Bisglycinate. There's other formulations that often are prescribed for iron that I still see happening now, and often they'll cause constipation and won't necessarily absorb that well. The bisglycinate is probably the best formulation. So if you have a prescription from anyone or looking for it over the counter, this is the best one to look for when it comes to dealing with heavy periods. It may. Are you guilty of Amazon as well, like myself? Or pharmacy? Yeah. All right. Okay. I think we may cap it here. If oh, actually, one last pearl. This is a little bit of hodgepodge at the end, but multivitamins. You may hear about just take a multivitamin, or especially in preparing for getting pregnant, or prenatal vitamins during pregnancy. I would look for the methylated version, and this is, I'll leave it on this note because this would dovetail into a bigger nutrition talk. But methylated vitamins is specifically referring to two B vitamins, that when we take B vitamins into our body, we have to have the ability to methylate them for them to work in our body. And it is being found that more and more people are being recognized as deficient in that ability to methylate. About 30% of people. The test to find that out is can be hundreds of dollars. But we all need to eventually be using methylated vitamins in our body, so it's just easier to go ahead and get methylated B vitamins. So it doesn't have any negative effects for people who don't have that gene problem. So it's literally called methylated vitamins. It can be, for example, methylated prenatal vitamins. And so during childbearing years, that's the most important thing, is to be taking that already, so we have enough B vitamin before getting pregnant. The methylated version is the best version to have. Your encapsulations. Yes. Correct. Yes, it is on Amazon. I have seen that. That is correct. Yes, on Amazon. So yeah, over the counter, so you don't need a prescription, and that is a pretty good product as well. MTHFR. Uh-huh. So yes, you're correct. So MTHFR is the enzyme that may have the mutation that would prevent people from methylating and making full use of all the enzymatic processes that require that vitamin. So we can cover that on that's a whole big other topic, but I wanted to give that little nugget at the end of this topic. All right. Well, thank you all very much. I didn't realize I kept you all here this long. Thank you. And I'll get with Sister Shay on the next one.